50 million Americans have arthritis, and it is the #1 cause of disability in this country. My guest, especially Molly, knows this all too well, and of course, Dr. Baxter and Molly Haines, who's going to be honored at the Bone Bash coming up this weekend. And Dr. Baxter, welcome to you as well from Hughston Clinic Orthopedics.
Thank you for having us.
Thank you both for coming in. I know this is an all-encompassing illness that, Molly, you've lived with and you treat daily, Dr. Baxter. Let's start by talking first about the event coming up where you're going to be honored, Molly, and what your role is in the event as well. Dr. Baxter, whoever wants to start first. Molly, jump in.
Yeah, well, it's really an opportunity to just raise awareness and raise money for kids and adults that are living with arthritis to have access to resources that previously, you know, I have recently got involved with Arthritis Foundation, that, you know, living with arthritis and that I wasn't aware of until I got older, and just giving kids and adults access to being able to go away to camp and really a support network for people living with arthritis and millions living with arthritis. And so very excited to be able to share my story and for others to get involved and raise money.
And that's very empowering for people to hear it from someone who's lived it, who's walking the walk.
Yeah, and I think it takes a personal story sometimes for people to really understand.
Okay, Dr. Baxter, let's talk about arthritis, the illness, and I know there are about 100 different types of arthritis, but we're basically talking what?
Yeah, basically arthritis, the main one most of us deal with is osteoarthritis, and then there's probably the next most common would be rheumatoid arthritis or post-traumatic arthritis, but there are many different types. But arthritis basically in general is where your joint gets the smooth cartilage just loses its smoothness, if you can think of it like becoming like sandpaper, and you get stiffness and painful range of motion and just the real inability to do the things you want to do, much less your daily activities.
And Molly, let's get into more about your personal story. You developed arthritis as a kid, as a child.
I started showing symptoms around about 7 years old, and I started walking with a limp, and first went to an orthopedic surgeon and just you know, talked about walking uneven with a hip variation, was put in different orthotics, and then would go to different doctors and get different diagnoses, but really nothing that would cure the pain. And so it took about 3 years to get to an actual rheumatologist that to give the proper diagnosis. And at that time, rheumatologists were very rare, especially pediatric rheumatologists. And so actually to fly out of state to see a rheumatologist, there was none in the state of Nevada where I lived. And so that just shows you that the specialty is very rare. And so I flew out of state and luckily was given the right treatment, but just to give you an idea of the resources being rare at the time, and so that's why it's very important for me to work for the cause.
Do you hear stories like this about people getting diagnosed later, especially with children?
Yeah, the type that Molly has is a little more rare than what we see normally on a day-to-day basis, but it's certainly a really big problem, and she's right, there's not many specialists to that degree, even though most of us specialize in adult arthritis, so it is a really big problem.
Okay. What do you see most commonly, and let's talk about treatments, diagnosing and treatments.
Mainly, you know, as people get older, the baby boomers are really aging up, and there's so much joint pain as far as knees and shoulders and hips, whether it's post-traumatic from playing too hard in our earlier years, overuse, or just our age, or family history really plays a big part. And so we will normally start out with a history, what kind of problems are you having, we'll get x-rays. X-rays are really good, and we can diagnose most forms of arthritis with x-rays. Certain types, like the rheumatoid, normally requires blood work as well, but MRIs are really good at picking it up, and so common treatments would be anti-inflammatories, injections. We have a lot of injections now that we can use. And then, of course, some of the last things we do are joint replacements, but physical therapy, limiting your impact on sports and your cardiovascular really helps.
Okay, and Molly, maybe some advice from you for folks watching who have really been impacted by this illness. What's really helped you manage it?
Yeah, I think the most common misconception is that you need to, lay down and rest, but I think advice is to really keep moving and be active. I mean, I was so adamant as, in high school and college to continue to move, and I was a cheerleader, and being able to, even as an adult, really be active, and even if you can get up and walk around the block, I hope Dr. Baxter would agree, it's really important to be moving your joints and be active, and that's the most common advice. And also, like I said, there's a mental health component too, really be talking to people and getting a support group, and that's where the Arthritis Foundation comes in utilizing those resources.
Well, you're a great advocate. Obviously, I'm sure they're tickled, and that's why they're honoring you, because you are very articulate about it. And Dr. Baxter, as we wrap up this segment, advice for people who are suffering with arthritis.
Well, I think you need to stay active. I think you need to seek treatment. I think ignoring it is not going to make it go away. And I think the future in the cure will be a biologic answer, not a replacement, but we're not quite there yet. And I think that's on the horizon. But I think motion, staying mobile, keeping your joints moving is best.
Okay, and wishing you both, hope it's a successful event.
Thank you.
Thank you
Okay,
so
the Bone
much.
Bash. Thank you both for coming in, and we'll be back with more after this.